Call it a clan.
Call it a network.
Call it a network.
Call it a tribe.
Call it a tribe.
Call it a family.
Our tagline is helping families be families since 1835. And how do we do that? We do that by concentrating on young children, youth leadership, and family strengthening. Our programs are Strong Start for young children, Youth Aim for youth, and a variety of parenting courses for family strengthening.
FSGB is a pretty unique organization in the sense that we have so many programs to support families. Kids that we work with through Strong Start are sort of some of the most vulnerable kids, so they typically have multiple risk factors. All of them are low income. That's how they are at the daycares that they're at or the preschools that they're at. Most of them come from one-parent households. Most of them have parents that were teen parents, or if not teen parents, they have pretty low educational attainment. And most of the kids live in pretty violent areas and have been exposed to a lot of violence and trauma. I have 2 kids on my caseload that have witnessed one parent either kill or attempt to kill the other parent. The goal of the program is to really intervene as early as possible so that we can get them to have more self-regulation skills, more ability to stay on task, better attachments, and more ability to have peer relationships.
Youth Aim is a leadership development program that engages a diverse group of youth to do community service projects and educational workshops in their community.
These type of organizations is like my safe place where I go. It's somewhere where I don't feel like I don't get judged. I can put an input in and it'll actually get listened to.
When I'm in a place where I feel comfortable and I feel like I can be myself, it helps me be more creative and more expressive.
Community Day was an event that happened outside. It was intended to bring out families and children in a peaceful, unified manner. And so we brought out about 100 youth and families, and it was an excellently successful event.
You look at our teen living program, and these are young women between ages like 13 and 19 who have a child 6 years of age or under. And that's tough.
I got pregnant when I was 18. I was living with my sister. My sister kicked me out. She didn't want me there.
My mom was pregnant at the same time as me. It was complicated. I didn't get any help or support.
We have 3 goals that we focus on: making sure that they're educated, making sure that they develop their parenting skills so that they can provide their children with the best, and also making sure that they understand what it takes to live on their own, so their independent living skills.
I never had a father. It's like, I don't know what a father feels like.
My role is the supervisor of the Helping Fathers Be Fathers program, working with fathers and their families and their children and their significant others is a little bit different than other clinicians in the Center for Behavioral Health in particular. Before a man was a man, he was a boy. And so remember, if your boyhood was pleasant and fun, do those pleasant and fun things with your son. But if it wasn't pleasant and fun, or there are aspects of it that you remember that maybe you haven't shared, let's share those, let's talk those out so that you don't pass that on to your son. That kind of stops with you.
People come in with a presenting problem, or they bring their children in with presenting problems, and we try to help them work on those problems and hopefully leave without those.
We go in the home and families that are in crisis or in stress, and we help them find ways to stabilize their families. Basically, that's what we do here. The way we look at it, it's like this is a family system, it's family-focused work. We have to provide it for everyone in the family to make sure that everyone is okay and everyone is in a safe place, and that everyone is a place where they can kind of be supportive of each other.
Child-parent interaction and problems associated with that cuts across ethnic lines.
If you were to take the years of experience of our clinicians, probably well over a couple hundred years of experience, if you added up the number of years that people have been in their roles, I can talk to you about the impact and the outcomes, and that's critically important. but it gets down to the transformation that we help guide people through and how those transformations are really lifting up the full potential throughout the generations of families that we serve.
And people have their own skills, their own giftedness, and I don't think that our work is to give them something they don't necessarily have. It's just to, for men in particular, help them slow things down so that they can bring the best of themselves out for their significant others, and definitely for the children, because the children are sponges.
You can't treat a child in isolation. You have to treat the entire family if you want to see change within the family. And especially because most of the dysfunction that we see in young children is related to the family.
The FSGB is out there in the community, and they're meeting the community's needs at all levels.
Our Strong Start program, our Helping Fathers Be Fathers program, our Youth Aim program, all of these 3 key initiatives are privately funded. These 3 key initiatives carry among the highest potential of return on all donor-provided dollars. A dollar that goes into early education and healthy child development is going to yield $17 to $20 in return, because that child is going to be in school and learning, will not go into other systems. They'll go through and be all that they can be.
My family thought I was not gonna do, I was not gonna do it. I was not gonna handle the situation about me pregnant, being a mom. But I show everyone that I did it.
It's for the families, and it's for the satisfaction of knowing when you go home from work that you've made a difference in their lives and that you're going to produce sort of long-term outcomes for this family and long-term change.
Men deserve it, women deserve it, families deserve it, and definitely the children deserve it.
We've been helping families since 1835. We intend to help families through the next generations to come.
Call it a clan.
Call it a network.
Call it a tribe. Call it a family.
Whatever you call it.
Whoever you are,
You need one.